Action News, Delaware Valley's leading news program, with Jim Gardner.
Summer will be here before we know it, and many women may be anxious about how they will look. Now there is a new procedure for one common problem. Erin O'Hearn is here with now more on the solution. Erin?
That's right. Hi, Jim. Well, it is often called the holy grail of plastic surgery. In a field that has perfected erasing wrinkles and adding curves, a solution for one of the most common patient complaints has eluded even the most cutting-edge cosmetic surgeons. Cellulite, most are told, is just something you have to live with. Well, some promising results from a new procedure suggest you may not have to. From movie stars to runway models to summer-loving beach dwellers, Cellulite does not discriminate.
I've always considered myself in good shape, and I've been cursed with cellulite.
For Meredith Edelman, the solution has always been to cover it up.
Even when I'm at the beach, I'm always pulling my skirt on and off.
Cellulite has nothing to do with a person's weight. No amount of diet or exercise or expensive creams will get rid of it.
There's really been no permanent treatments to cellulite to date.
But don't pack away those summer shorts just yet. Dr. Paul Glat says Cellulaze is a new laser procedure that appears to have promising and relatively long-lasting results.
We do expect about a 50 to 60% correction as a permanent type of situation. I've been finding that we're getting more than that.
To understand how it works, think of cellulite as a mattress, with the bottom being a layer of tissue and the mattress springs being fibers. As the springs pull down on the top of the mattress, which represents the skin, you get a buttoned, uneven surface. During the Cellulaze procedure, small incisions are made in trouble spots, and then a laser is inserted under the skin. The energy melts the fat, severs those fibrous bands, and tightens the skin, eliminating that orange peel look.
There's different variations of severity of cellulite, so the least severe tend to get the best results, whereas the most severe, we are a little more tempered with our expectations.
These before and after pictures are pretty impressive. It's important for patients to know this is not a weight loss procedure, and unlike liposuction, it does not remove fat. Although Cellulaze has shown promising results, Bryn Mawr plastic surgeon Dr. Ronald Lohner has reservations.
I think my first reservation is it's new technology. There's a very high potential for burns in the skin with this technology.
The makers of Cellulaze are heavily marketing it as, quote, one simple anti-cellulite treatment. Lohner believes this is a very promising technology, but cautions that Cellulaze is still a surgical procedure. Patients will get a significant amount of bruising and be required to wear a compression garment for 2 weeks.
The problem is it's still invasive. You still have to put a catheter or a cannula or a probe inside, and you still have to numb somebody up. It's not as simple as doing something with some type of topical technique.
And the treatment is costly, ranging from $5,000 to $10,000, depending on how much cellulite a patient has. Lohner believes, as with any new technology, there will likely be adjustments made as they try to improve the procedure or fix unforeseen problems. Currently, the company that makes Cellulaze only sells the equipment to doctors with a liposuction background, which is good to know. We're going to check in with Meredith in a few weeks and see how she did.
So you've been off for a while,
For a little while, yeah. Feels good to be back.
In fact, you've been off for a year and a half.
A year and a half, not just a few weeks.
What have you been doing?
I have 2 beautiful kids at home that I've been running, sometimes sprinting after. And they've been keeping me busy, but I miss my Action News family, so I'm glad to be back.
And one of the things, ironically, one of the things you're going to be doing here is filling in for
Nydia, while she enjoys her maternity leave.
Which could happen at any moment.
Any day. We were talking about that earlier. I feel like I'm making a call in the middle of the night.
It's great to see you.
Thank
great
you.
to have you
back.
back.
It's great to be back.
And welcome.
Thank you so much.